I didn't have any specific injury. It was just a gradual, I guess, decline in my health, where I was, starting to notice pain. So I started by, reaching out and going for maybe physical therapy. I visited a back doctor who suggested physical therapy. And after 5 or 6 sessions of that, I really wasn't getting any relief. So the next step was to go for the steroid injections, which, from what I understand, relieves the problem for like 90% of the people who go. And unfortunately for me, I went for 3 or 4 rounds of those injections without any relief. After those injections proved to be, unhelpful, I ended up visiting Dr. Kakoulides. Upon meeting Dr. Kakoulides, he did not want to rush into the surgery. He made me explore every other possibility before we would even talk about surgery. In fact, at that point, I had not gone for the nerve ablation, and he said that we wouldn't even consider surgery until I went for that procedure. And when that proved to really not be successful, then we came back and had the discussion about the surgery. I felt very comfortable with Dr. Kakoulides from the beginning. He had that good mix. He had a nice bedside manner in that he was very engaging, very clear about what the process was going to be. He did say that, my problem was really more hereditary. I had some arthritis. There were a few issues that I had not related to any type of an injury, but he explained everything very clearly. And at that point, I was in such pain that the surgery really was no other option. So we scheduled the surgery, and it was a spinal fusion to repair 3 damaged vertebrae. It was funny, the first day, the surgery was on a Friday. On Saturday, they get you out of bed. And the first thing I noticed when I stood up was that I could stand up straight for the first time in probably 2 or 3 years. The fact that I could walk without pain was, phenomenal. It was something that I hadn't felt in about 2 or 3 years. And really everything Dr. Kakoulides had told me prior to the surgery came out to be absolutely true. He prepared me by telling me the first couple of weeks you're going to be a little bit out of sorts, and that's as a result of the incision, the anesthesia. He says, but after a couple of weeks you're going to start feeling more like yourself and wanting to do more. And within inside a couple of weeks, I would say I was probably walking, up to a mile a day. I'm riding a stationary bike, I do that. I'm actually running again a little bit, not nearly as much as I had been running prior, but that's really more my choice than anything related to my back. I've been rollerblading, and I've taken up yoga. So these are all things that 2 or 3 years ago I couldn't even think about doing, but now it's a part of my regular life as a result of the surgery. Without the surgery, there's no way I could even consider thinking about doing these things, let alone actually doing them. If there was a patient that was considering spinal surgery, I would suggest that they basically follow the same steps that I did, which is to make sure you do everything prior to the surgery to make sure that that's your best option. And if you do the surgery, you really have to follow what your surgeon tells you. Dr. Kakoulides was very clear about the things that I should be doing and should not be doing during the course of the recovery period. And if you follow the directions of the surgeon, you're going to have a great outcome.